So now we are going to go over how to bill and set diagnoses for a patient. So you should have already watched the initial and follow-up charting video that kind of goes over all of the patients on initial charting, follow-up charting, and what the different colors mean on this appointment tab. So for the billing and coding, once you're done charting and you like what you see, you will go, and you should not have locked the note. If you have, that's not a big deal, but if you have not locked the note yet, you actually lock the note last. But I did want to have a separate video on billing and coding. So you go to your patient appointment, and I know there's a billing tab up here, but this one's more confusing. It's more difficult. Once you can use this if you'd like, but please, if you go this way first, and there's a reason why I'd like you to do it the way I'm going to show you instead. So you go to the appointment, you do the view clinical note. All of this information comes up. Again, we talked about the H&P, the SOAP, and the additional. All of our charting is done in the additional. The only thing we do under the H&P tab is the billing. So you go to the billing. So the billing will be, you have to fill out the ICD-10. We recommend at least 5 diagnoses codes in the ICD-10. You typically get most of these codes from the EMR that the facility uses for the patient. So a couple tidbits on that, however. Sometimes the facility is not very quick on getting their diagnoses in. And if you're quick with your charting, you may actually have a situation where you do not have enough diagnoses codes to get the 4 or 5. That's okay, but you need either a depression diagnosis category, so it could be major depressive disorder, could be anything under the anxiety category, and it can be anything under the psychosis category. So with that, if you're seeing the patient, they're not on any meds, they do not have depression, they do not have anxiety, they do not have psychosis, we cannot bill for dementia, we cannot bill for insomnia. There's actually a lot of things that do not qualify us to bill in the skilled nursing and the long-term care setting. So this will be a very important code I want you to write down. It's F43.23, and this is adjustment disorder with mixed anxiety and depressed mood. Any adjustment disorder will work. So if you start typing adjustment in here, it'll come up. So all these will come up. So from F51.02 all the way up to F43.2 will work in order for you to get paid. That's just the one I typically use the most often. But again, these are the adjustment disorders that you can use. I don't think I should correct that. Adjustment insomnia does not work. It has to be adjustment disorder of some other nature. But I do believe from F43.29 to 43.20 do work. But again, I know for a fact this one pays, and it does pertain to about 90% of the patients that are in the facility that you're seeing. And you can move these. So you'll notice that if you're in an EMR for the facility, if you're like me and you use 2 screens, which I highly recommend when you're charting at home, you have one screen up, the EMR for the facility, that will give you the meds, the diagnoses, the progress notes, the hospital documentation, all the information you would possibly need, vitals, in order to chart, to finish your charting, to see that patient. You may come down where you go through a bunch of different diagnoses that you've added. You try to add ones that can be mental health related, for example, like hypothyroidism. Well, that can definitely be a contributing factor to depression. So you want to use that instead of, some of the other diagnoses on there. But again, it's more important that the first number 1 line has to be something mental health related, and it has to be either depression, anxiety, psychosis, or I guess in this case, adjustment disorder. So if you're going through and you add all your diagnoses, you got 5, and then all of a sudden at the bottom of the list you found depression and you add it, you'll notice that, say it's, you know, whatever it happens to be, let's say it's brief psychotic disorder was at the bottom of the list. And all these other ones are non-mental health related. All you do is drag your mental health diagnoses to the top. It reorders. Well, it didn't work there, but it usually works. Yeah, there we go. So making sure that the number one diagnosis is mental health. Now, over to the billing side. This is, you have to put in the billing codes under the CPT codes, and this can be a little bit daunting and intimidating. However, I did make profiles, billing profiles, that should cover you 90% of the time, 95% of the time. So if you really want to see the billing pick list, you can use and look at all the billing codes that we use, that we have as a practice, and you want to take a look at these. I would recommend avoiding this until you get a little bit more savvy with the billing and knowing the codes and what they mean. For now, I would highly recommend that you use the billing profile. And so if you're a counselor, you use these codes right here. If you're a nurse practitioner, psychiatrist, if you're in the hospital or in inpatient rehab, these are the codes that the templates that you use. And if you're in a nursing home, skilled nursing, long-term care, something along that nature, which is most of our facilities, these are the follow-up codes, and these are the new patient codes. So nursing facility, new patient, nursing facility, follow-up. The last codes are for a recovery unit. We do have some recovery facilities. The ones that are applicable to you, you can just ignore the rest. So again, most of our facilities, most of what we're working with is going to be nursing facilities, which is long-term care and skilled nursing. So with that, when you go see a new patient, which again, you should watch the previous video first, the red patients and the yellow patients are all going to be new patient billing codes. And as a general rule of thumb, we do psychotherapy up to 6 hours a day. We total we don't recommend seeing much over 6 hours of psychotherapy on any given day. But my recommendation to you would be to, keep track of how much psychotherapy you're billing and stop after 6. And that'll make more sense when we get farther into this. But so let's say that for that patient we just charted on, new patient, or I'm sorry, the patient was education, and we did a new visit, and we did 18 minutes of sleep hygiene psychotherapy. So the appropriate code would be the level 3 with a 16-minute psychotherapy. You get the little tab here saying that's what you want to add. Populates, there it is. So you got your first initial high in your psychotherapy with your E&M of 30 minutes. And again, if you accidentally click on the wrong one, it's not a big deal. You just exit out, erase them out, and start over. So let's say we did a follow-up visit, and the follow-up visit, we did not a lot of med management. We did quite a bit of psychotherapy. Your level 2 with 40 minutes, that would be the next code. You click on that. Boom, the codes already pop up for you. That's the codes that are going to get billed. So I can't make a profile for every single scenario. So, but what I've put in here is what you use most of the time. And so let's say that you had a really, really busy day. You saw 24, 25 patients, and 12 or say 10 of those were new patients. So you're probably going to be pretty close to burning up your 6 hours of psychotherapy that we would recommend not going over in a particular day. So what we recommend is you can still use these templates, but let's say you're billing a follow-up code, a level 2. So there's a level 2 with 16 of psychotherapy. There's a level 2 with 40. Either one of these would work if the E&M that you're trying to bill as a level 2, you just click on either one of them, hit OK, and then just erase the psychotherapy component. Well, that's going to, sometimes Dr. Chrono gets a little glitchy. Just hit the refresh button. If you clicked on something and it doesn't populate, just hit the refresh button. It'll typically pull up. Then and then just erase your psychotherapy code, and then it just leaves the E&M code. So, and as a rule of thumb, in skilled nursing facilities, so this is for skilled nursing only in long-term care, what we typically see is about 80 to 80%, 85% of our initials will be level 3s with 16 minutes of psychotherapy, more often than not. And the remaining, roughly 15% would be level 2s with 16 minutes of psychotherapy. So these are your initial codes that depending on the facility you're at, between 70 and 85% are level 3 with 16. The others are level 2 with 16. And again, you can bill them without, but these are the codes that use most often. And this is a statistical average that, with all of our providers at all the facilities when we run the analysis, that's what we typically see. Level 1s are typically for those patients that you're not really doing much for. Maybe the patient is A&O times 0. They're, probably contemplating hospice. You're not really managing or doing much at all. There wasn't much to review on the chart. Or you went into the patient room, they told you, they kicked you out, so you really didn't get to do much. Then a level 1 in those scenarios would be appropriate. But we do, as a rule of thumb, statistically speaking, see those less than 1% of the time. But again, you're the provider, you pick the billing codes, you pick what's appropriate. I only can tell you what statistical averages that we see, but again, you're responsible for your billing and your billing codes, so you have to do what you feel is appropriate. But on average, that's what we're seeing for new patients. For follow-ups, I would say that it's about 50-50 level 2 and level 3s for the E&M codes. Typically you have to read the rules and regulations on what constitutes a level 2 versus what constitutes a level 3. But again, if you're managing a patient, if you're titrating a med, if you're looking at a lab, things of that nature, you can build a level 3. If you're just monitoring something, you're not really making any changes, you're just checking up on the patient, making sure they're doing okay, that's a level 2. And then the appropriate psychotherapy obviously goes along with the minutes of psychotherapy that you provided. Level 1s, again, we typically less than 1% of the time see a level 1. However, if you feel that that's appropriate, you spend just a couple minutes in level 1. But again, it's about 50% level 2, 50% level 3, with less than 1% level 1s for follow-up codes. Now, there are scenarios where you're going to be in the patient, maybe there's some suicidal ideation, there's some very specific codes for those things. If you need some help with some of that, give me a call. I don't want to go into details on every single scenario for every single billing code. I just want to go over ways to save you time, spend less time charting and billing and putting in diagnoses codes. So these templates should pretty much cover you, like I said, 90+% of the time. And when you're done, this will be what it looks like. So let's say this was a follow-up. These are your diagnosis codes. Make sure you have one mental health at least as your primary diagnosis code, and it falls under adjustment disorder, psychosis, depression, or anxiety have to be the number 1, or it will get rejected by insurance. And they got at least one billing code in here under your CPT codes. And then we'll kind of repeat what we did a little bit in the other video, because technically this should be the last thing you do before you sign and lock the note. You should have not have signed and locked it up to this point. If you did, It's not a big deal. The billing codes still get entered, but you go to preview note. And then what we did last time shows up here in that last video. You go through, you make sure everything's okay. Take a quick glance at it. You're happy with it. You sign and lock it. And again, we didn't do our lab and diagnoses, but that's fine. This will sign and lock under the conditions. And what that does is, if you watch the last video, once you sign and lock the note, you should be charted on the patient. You should have put in your diagnoses codes, at least 5 diagnoses codes. And the number one, it should always be a mental health diagnosis code, and you should have a billing code before you sign and lock. And once you sign and lock, our team will bill the insurance company for reimbursement for your time, and our back office will now be triggered to upload the note into the EMR that the facility uses, and so that they can get your note on what you've done with the patient. So again, this is technically the last step. If you have any questions or concerns, always feel free to reach out. Thank you.